good morning. Thank you for coming in to meet with us. Could you tell us a little bit about yourself?
Yes, my name is Josephine Bittner. I am currently finishing my Associate of Applied Science in Diagnostical Medical Sonography at ECPI University, and I will be graduating in August 2026. Before entering sonography, I worked in healthcare. I was a pediatric urgent care receptionist, and I also worked concurrently as a PRN home health aide.
Great. Could you tell us what is one of your greatest weaknesses?
Yes, one of my weaknesses I've noticed recently is that I tend to hyperfixate on these small details. For example, even if I have everything I need in an ultrasound image, I will still take a little bit longer than I need to make sure I have the perfect image. I have been trying to work on this. I have been using checklists and trying to keep a time schedule.
Has that been successful in helping you?
Yes, it has. I have noticed an improved difference.
Excellent. We love to see that. Do you have any questions for us?
Yes. First, what does the orientation process look like for a new graduate sonographer?
Well, first you'd show up to your first day. We'd take you through the orientation and you'd have a meeting and get your badge and all those kind of things.
Wonderful. Second, what type of examinations would I perform most often in this position? I know the general vascular exams. I was just wondering if there were any extra ones that are specific to this position.
We do a lot of the general protocols, so you can expect to see kind of what was in the job listing.
Okay. And then finally, what qualities do you think would make someone successful on your ultrasound team?
If you're a team player, if you are someone who gets along well with others, those are the type of things that we're really looking forward to seeing. And do you have any other questions?
No, that was it. Thank you.
Could you tell me what is your favorite sonographic exam and why?
Yes. My favorite area of sonography is vascular ultrasound, especially carotid exams. I love them. They can either be fast, easy, simple, in and out, or they can be surprisingly difficult and tricky, especially if a patient has tortuous vessels. It sometimes just makes it a little bit more challenging, so I love that.
Excellent. This is the perfect position for you. Thanks for applying. Could you tell me which area of sonography you find most challenging and why?
Yes. So 2 challenges automatically come to mind. That would be an emotional challenge, I suppose. When we're scanning patients, especially if we see that there's bad news, so to speak, that we're taking an image of, we have to be really careful to not let that show on our faces, because that's the physician's job, not ours. And it takes a personal emotional toll on oneself also. The second challenge, I would say, is more of a technical challenge. The going mobile and doing the inpatient exams when the patient is comatose or unresponsive. First off, they're not able to help during the exam at all, which adds to the difficulty. And then you are having to maneuver around any wires or medical devices that the patient has, and that makes it extremely challenging to get good diagnostic images that the physician will be able to really use to help the patient.
It's very true, very, very true. Do you know why the sonographer is considered the bridge between the patient and the physician?
Yes, because we are the ones explaining the exam to them. We're telling them why they're getting it, why their doctor ordered it. We are getting the thorough patient history, and then we also have to make sure that there is clear, open communication and attention to detail. When we are writing up our reports, we need to make sure that we are communicating clearly what was seen during the exam to the physician, and also we have to make sure that all of our images are extremely detail oriented and that they are diagnostic images that the physician will use to help aid in the patient's care and diagnosis.
true. These are definitely qualities we're looking for. So we appreciated meeting with you today. Do you have anything else you'd like to add before we close?
No, I just want to thank you for taking the time to speak with me, and I appreciate the opportunity to share a little bit about myself, my experiences, and my passion for sonography. Thank you.
It was a pleasure to meet with you. Have a great day.
You as well.